Large-breasted women are consulting with plastic surgeons about reduction mammoplasties. Let's say you're a patient who is a double D or triple D or frankly a D cup and would like to not only be reduced in size but are having all sorts of shoulder pain, back pain, these kinds of issues. These are legitimate indications for what's called reduction mammoplasties, reducing the size of the breast, lifting the breast, etc. As a standard of care issue, plastic surgeons will obtain a mammogram prior to a patient undergoing a reduction mammoplasty. However, there are circumstances and times where you can have an incidentally found breast cancer. A good example would be an in situ breast cancer that was not seen or noted when the patient had her mammograms done. So how should such an incidentally discovered cancer be worked up and therefore treated? However a cancer is found, whether it's incidental or through diagnostic or means or by the patient, no matter what, the cancer should all be treated the same. So a woman who has undergone a reduction mammoplasty, who's been found to have an incidental in situ or invasive cancer, should be completely worked up with the appropriate mammograms, the appropriate MRI examination, and then the key with an incidentally found cancer in the reduction mammoplasty, where they have literally discarded some of the tissue away, is to make sure that the margins are clear around the cancer, just as we do always. Then the standard of care would be radiation therapy, depending on what's going on. It might even involve doing a sentinel node biopsy if it's an invasive incidental cancer, and then the appropriate anti-hormonal therapy, etc. These incidentally found cancers are fortunately quite unusual, but if they occur, occasionally you have to go back and take out more tissue. As I've said repeatedly, please be involved with a multidisciplinary team. An incidentally found cancer is good fortune because hopefully such an incidentally found cancer is quite small, hopefully in situ, and therefore hopefully the prognosis and the outcome will be really wonderful. It'll be better having been found incidentally than perhaps even being found diagnostically or palpated by the patient. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.